Hello, everyone. My name is Jim, and I'm the Director of Patient Outreach at Patients Rising, a 501c3 nonprofit whose mission is to help smooth the path for patients to be able to get access to the treatments that they need when they need them. This could be about cost or insurance obstacles, whatever the case may be. We're here to advocate for patients and help them get what they need. Now, we're not a disease-specific organization like the MSA Coalition, so we can work with anyone on pretty much anything. And thus, here I am. I want to thank Cindy and Joe for having me here. I'm really glad to talk to you. So let's get right into the good stuff. Prior to being approached by Cindy, I didn't know very much about multisystem atrophy. And I still don't know much. I'm a novice for sure. But what I'm going to be talking about today is essentially applicable to any rare disease community. The first thing I want to talk to you about is learning. I find that a lot of patients in rare disease space do not feel confident in their knowledge about their disease. Oftentimes, that's because there isn't a lot. Rare diseases, of course, because they're rare, you're familiar with the term orphaned, which is to say, companies who are out to make money don't see a lot of money-making potential in treatments or understanding of rare diseases. So it becomes a little more challenging to find good information. Now, you could go online. Most of us do, of course. And you may find information about MSA on a doctor's website or a community support group. But I've learned to be cautious about information from such places, because unless they are really rigorously put together, the line between fact, opinion, belief, and supposition get very blurred together. That's not American Sign Language, by the way. That's just me going like that. So I've learned not to trust it, at least not out of hand. When I'm trying to decide if I do trust something I see, I look for citations. Citations are like if you go to a Wikipedia page, or if you read a peer-reviewed article from a journal or a website that hosts those articles, the citations are those things that interrupt your reading, like some statement about the disease, and then you'll see a parentheses, a little number inside, and that refers down to a paper that was written on that topic down in the bibliography. Citations are really important because they tell you that the person who's conveying information to you is not just talking out of their head or their butt. They're talking as part of an ongoing conversation with other researchers, doctors, patients, and support organizations. So anyone who stands up in a bar and starts extolling about everything that they know on a given disease, great. They have the freedom to say whatever they want, but you would do well to listen with tongue in cheek. So learning about your disease is important for one primary reason. You need to be able to have a conversation with your doctor where you're both talking the same language. when you go to see a doctor for the first time, maybe even before you're diagnosed, you're having symptoms, you're scared, you're confused, you're not sure what's going on. You come in talking about your symptoms, and your doctor is talking about your signs. And the conversation is not usually equitable. You're using common language or language you've learned in your support groups. Your doctor is speaking Latin and Greek, sometimes literally, and a miscommunication happens there. Now, we're going to talk a little bit more about communication in a minute, but if you learn about your disease from sources similar to the ones your doctor learns about your disease, then you're speaking the same language. There needs to be good communication between you and your doctor. And in order for that to happen, you have to understand the words that are coming out of your doctor's mouth. So getting information from good, reliable sources, the same sources that your doctor might be getting them from. Oh, yes, a little light bulb just went off. What am I talking about when I say reliable sources? Again, we're talking about peer-reviewed journals or information that has been distilled and curated by a reputable organization like NLM.gov, the National Library of Medicine, or MayoClinic.org, Johns Hopkins, Columbia University, any institution that is nonprofit or government-based, which means that they should have the public's best interest in mind, not profit as their primary interest. They're going to put together information that is meant to be easily digested by the public. It's going to be reliable because they can't afford to do this badly. It hurts their reputation. So look for your .orgs, your .govs. Look for institutions you've heard of, Mayo Clinic, Johns Hopkins, any others that ring a bell, Mass General, you get the idea. And of course, government sources, because these are also vetted by NIH researchers, FDA, things of the sort. There's a pressure for that information to be accurate, up to date, and easily accessible. If you read these things and learn about your disease this way, you'll be able to have better conversations with your doctor. And that's really what the power that comes from learning about your disease this way. It gives you the ability, the power, the freedom to have meaningful conversations that you know what you're getting yourself into ahead of time, and you have a very high likelihood of a satisfying and successful interaction with your doctor. Okay. And I'm happy to take questions on how do you identify a good source versus a questionable one. If it's on Facebook, it's questionable. If it's Wikipedia, it's questionable, although footnote. I go to Wikipedia a lot, and rather than reading the text up at the top, I skim through that and let it take me down to the bibliography at the bottom, and that's where I get some good resources sometimes. Okay, now we're going to talk about relationships, which we were just alluding to. By the way, in the background here, you have a tent in a snowstorm. This is an ink sketch that I did lots of years ago. I seem to have cropped out the date. Anyway, I hope you enjoy. So, relationships. I'll tell you a little bit about myself. My father died a little over a year ago. He lived with Alzheimer's disease. He had it for about 10 years that we know of, where he required some manner of caregiving till the last 4 years of his life, he was completely bedridden. There were some really important relationships over that 10-year period. Namely, my mother, who was my father's primary caregiver, and then myself and my 2 siblings. When all of this began, well, we didn't know what to think, really. I mean, who does? This was new to us. There had been Alzheimer's in the family before in a previous generation, but for us kids, I'm 55, but well, to my mother, I'm still a kid. We were experiencing this for the first time. And so we had to have some difficult conversations about what our expectations of one another were, as well as what our expectations for the progress of the disease were. And even though those conversations were very difficult, having them brought us closer together, helped us balance the effort required to take care of my dad. Although, footnote, my mom, at her least, did like 90% of everything. But we helped out when we could, and gave her respite whenever possible, give her some time away so that she could live her life instead of identifying her entire existence as caregiver, something she would do without hesitation, was proud to do, to care for my dad. But as her kids, we wanted to see our mom having something better of a life than that. Something richer with more quality of life. And these are probably things you see yourselves in your own families and communities. So there's a place to improve the relationships in your life. That's the relationship with your immediate family, with your coworkers, maybe with your congregation, your local neighborhood or community, and certainly with your care team, your doctor, your nurses, etc. These relationships are all very, very important. And they can really make or break the quality of your life. So we already talked about learning, empowering yourself with knowledge so that you can know what you need better and better speak about how to get it. Now, if we incorporate the importance of relationships, we can see that there's an important need to be able to communicate with the people around you. Good communication between a doctor and a patient is vital. We're talking about being able to speak the same language. Well, now, if we speak the same language, we have to speak that language to one another with compassion and caring. I saw a lot of people in the rare disease community firing their doctors, angry with their doctors, almost like revolting against the system. I get that. It's frustrating, man. It's really frustrating. And there's a lot of losses, and those losses hurt. And it's hard not to see your doctor as part of that loss. But the truth is, your doctor is the key to the door that you need to go through to achieve a better quality of life and some semblance of wellness. So your doctor needs to be on your team. You have to have a good relationship with your doctor. It's not always easy. It takes work, like any good relationship. But it all starts with compassion, caring, and an attempt to understand one another. The stress in your family. Again, this comes down to compassionately understanding each individual's role in this rare disease. rare diseases do not affect one person, they affect families and communities. So spend some time nurturing your relationships. And the most important relationship of all is the one with yourself. Self-care is really important. I never thought that it was. I always believed that self-care was, deep breathing, mindful breathing, sleeping in on a Saturday if I was tired. Self-care is a lot more than that. We're not really going to talk about it here because it's a whole topic that deserves its own time and attention. But having a good relationship with yourself and your loved ones and your doctor will make your experience as a rare disease patient more tolerable and more successful. The last thing I want to talk to you about, well, not the last thing, second to last thing, are resources. Where do you find them? And how do you know if they're good? Well, we talked about that a little in the learning section. So rather than going over that same road again, I want to talk to you about your patient support organization. In this case, the Multi-System Atrophy Coalition. Or if you're from another disease community, the organizations, the nonprofits that support that community. The reason these communities are so important, these patient support organizations are so important, is that they're usually started by people just like you, who are filling buckets with problems that they're experiencing, but not finding a lot of solutions. So they build a place where people can find solutions together. Solutions to learning, solutions to relationship building, solutions to quality of life issues. But these patient support organizations make an impact most in that they understand what you're going through. They're usually built by patients or caregivers or survivors of the very disease that you're living with. So lean in to your patient support organizations. They're a great place to express yourself, ask questions, get tips, referrals to doctors, unofficial referrals to doctors who actually understand the disease. The newsletters and social media of these organizations help keep the community connected so that you fend off that loneliness and isolation that comes with living with a rare disease. You're probably the only person in your town, or maybe the only person in your city that you know of that's living with MSA. So if you can't find someone geographically close to you, you can find people who are electronically close to you in your online support groups. Facebook groups are great with an asterisk. The asterisk is for sometimes unreliable information you can get in a Facebook group because these are not monitored by medical professionals. And most Facebook groups, you'll see in their rules, this is not medical advice. This is not a replacement for your doctor. And yes, that's true. And those statements are important to make. But when you're desperate for answers and you turn to your community and you ask questions and they give you answers, it's like water when you're thirsty. You need it. But I have to caution you to take these things with a grain of salt. To be a better community member yourself, what you are better off doing is if you see someone raise a question or you're having a conversation about an issue in Facebook, add that citation. Get that article from Mayo or the National Library of Medicine and put it in there so people can see some facts and real information. So it doesn't sound like you're just sharing an opinion. You're sharing some actual information. Again, it's not medical advice, but it's publicly available information that people can rely on. Patient support organizations can be a good library of sorts for this kind of information. So turn to your orgs for help, because that's why they exist. No other reason. They're just there to help. Okay. Speaking of resources, the last thing I want to tell you about is the Patients Rising Concierge. Now, this program is important because it helps anybody with anything. That sounds pretty broad, and that's because it is. We didn't initially build it that way, but it turned out that way. Well, let me tell you a little bit about the Concierge program and how it happened. So at Patients Rising, it was 2019, and we were putting this idea together, a helpline, not a hotline, but a helpline, where people could contact us about insurance policy issues, prior authorizations, step therapies, copay accumulators, problems with their medical records, things like that. And we, in turn, could give them advice based on the research we had done and our policy positions, which were based on good scientific and crowdsourced information. And it started like that. And it was cool. It was great. You know, we were helping some folks with some things. And then, you probably all know where this is going, the coronavirus lockdowns started. And then our phone calls went from, oh no, step therapy, to, oh no, I'm out of food. Where can I get some food? How do I pay my rent? Oh my gosh. Or, you know, my mother, who is the adult in the house, is now in the hospital. What do I do? How do I pay my rent? Every conceivable question came up. So we decided to change our email for the concierge program to ask us anything at patientsrising.org. And this challenge to the public has been answered. People have really asked us anything. There are some things that people have asked us that I can't even share on a rated G presentation like this. I'll leave that to your imagination. But the truth is, people reach out to us about all kinds of things, either by phone, by email, or coming to our website and doing a search on their own. Because there are a lot of holes in healthcare, whether it's out-of-pocket costs, co-payments, premiums, or it's transportation to and from your doctor, problems with your medical record that you don't know how to correct or address, privacy issues like HIPAA questions, but also things like, I need to get a ramp for my home because I've become disabled. Where do I get equipment at a reasonable price? You know, I need a mobility aid or something of the sort. Any kind of question, really anything. And so what we have become good at as an organization is researching services and programs that can help provide you with what you need. So if you contact us and say, you know, I have to begin chemotherapy and I don't have a car, we will take some information from you, use that to conduct a search locally to find transportation that you can use. Ideally, no cost or low cost, but sometimes you have to pay. It really depends on where you live and what resources are available, right? Or, you know, if you're about to be released from the hospital and you feel like no one is telling you what's supposed to happen next, or you've been released and you're supposed to get therapy, but you haven't heard from anybody, what do I do? Well, these things can be, I mean, they seem simple when we mention them here in this context, but if you're just discharged and you're expecting information, you're not getting it. It's confusing, it's scary. You're disoriented. Where do I begin? You can begin with us, and we'll hear what you have to say. We listen, and we try to figure out solutions together. We'll do the research. We'll send you the information by phone or email or text, whatever you prefer, and you take it from there. But we turn no one away. There are a lot of programs where you have to qualify based on household income or have a certain kind of insurance. We don't have any such rules. Anybody can contact us about anything. Occasionally we do say, we don't have access to resources like that. I don't know how to help you. But most of the time, we can at least give people some web links so they can learn more information. Or a place to learn about government programs that support this or that problem. We can put these things together in a tiny little package, give them to you, thus teaching you a little bit about how to fish so that we don't have to give you any fish, because we don't have any fish. We're a remote organization for the most part, and even if we weren't, I think keeping a bucket of fish in the office I just don't think that's a good policy. I don't know if you agree or not, but I feel kind of strongly about it. No fish in the office, certainly not in the microwave. My point being, we want to give you the tools to empower yourself. We can't empower you. That's something only an individual does to themselves or for themselves. But we can point you in the right direction, share the tools that exist, and find programs that can get you some financial help, for instance, anything. All kinds of anything you can imagine is out there somewhere. But when you're in a crisis, these things are not easy to think about. So let us do the thinking for you. We can even help you figure out what your problem is. A lot of times people contact us, they start giving us a life story, they realize things aren't working out, but they don't really know they don't know what to ask. So we can help figure out what you should be asking and then help answer it for you. So that's Patients Rising Concierge. It's there for anyone who needs it for anything. And we're really good, by the way, at giving you the organizations that maybe specialize in your needs. Like we have partners like Triage Cancer. So if you're having financial or legal issues around cancer, they are like the gold standard to help people. So we're partners with them. Somebody calls us with issues like that, we send them over to Triage Cancer. But for all the things that fall around that tree that are not fruits of their tree, but other detritus, we can deal with those issues. So I hope this was interesting for you. And I hope my presentation style was not too unnerving. Yeah, this is the whole deal. I'm going to stop sharing here, and I'm ready to take your questions. I've been Jim Sliney of Patients Rising, and it's been my honor to be here with you.